Brother Murtaza Merali, who is a member of our committee, senior committee, and will be the chairing the program today. Murtaza bhai.
My brothers, the seniors and sisters in Iman, Salamun Alaikum. This is the first meeting of the seniors, the male seniors, although we have learnt from the better half. And since this is our first session, and first of all, we appreciate you attending this session because short notice is also late, but we'll try and make it as quick as possible. And without much ado, I'll first of all introduce the chief speaker, Dr. Kaku, give you his brief background before he starts talking to us. Dr. Kaku is originally from Mombasa, Kenya, and he moved to the United States at the age of 19. And he subsequently completed his undergraduate studies at Lehigh University in Pennsylvania and received a bachelor's degree in biology with highest honors. And from there, he decided to move further north to snowy Rochester, New York for medical school. By the way, that's a good medical school. And in 2009, Onali graduated from the University of Rochester with an MD with a distinction in research. And then he completed a residency in urology at Children's Hospital, University of Florida, serving as the chief resident in his final year. And he subsequently pursued further specialized training in sleep medicine in Tampa, Florida. He's passionate about education, advocacy, research, and has authored several papers and book chapters in his field. He's married and has one son. After his speech, he will have to leave us, but questions will be invited, and we'll have two prominent doctors from our own community who will be joining us here. The first one will be Dr. Amir Balwani. He's known to you all. When I came to Florida here, every time I inquired about the doctor, I was told, contact Dr. Balwani. So believe me, he's no stranger to anybody here. Just a brief for those who don't know him. Dr. Balwani, born in Uganda. He graduated from University in Canada, and he's board certified in internal medicine. He practiced in Canada, North Dakota, Minneapolis, and now in Sanford, Florida. He is one of our own. And then you have a very tall, commanding figure, Dr. Suhail Ali. Where is he? Here he is, okay. Dr. Suhail Ali is an endocrinologist. His office is in Maitland, Florida, and we will have the opportunity to get responses of the questions from you from the floor when these prominent doctors will be sitting here. But Dr. Kaku, after presenting his talk, unfortunately, he has to leave, and we can understand that. So without much ado, I will welcome Dr. Kaku to begin his talk. Thank you, Dr. Kaku. I'm going to move on the side so that I don't obstruct you.
My elders, brothers and sisters in Islam, Assalamu alaikum. I want to begin by thanking the organizers for inviting me. It is my pleasure and honor to be here to share the little knowledge that I have with you, and hopefully to learn something from you all as well, inshallah. So the topic for today is stroke, and basically this will be the outline of the talk. We want to educate about stroke for these reasons. The reason we want to talk about stroke is, one, to reduce the risk of getting a stroke in the first place, so to prevent, because prevention is always better than cure. After that, to recognize stroke symptoms in yourself or in somebody else, so that when somebody is having a stroke or you're having a stroke, to know it and then to take action immediately. And then finally, how to respond to a stroke, what to do. Okay, so inshallah, we'll try to cover all this. So what is a stroke? So I'll try to make it a little interactive. How many of you know what a stroke is? You can feel, don't feel shy. So basically, a lot of people know what a heart attack is. And the way a lot of people understand a stroke is basically it's the same thing except it happens in the brain. So you can think of a stroke as a brain attack. So in a heart attack, a blood vessel that is supplying blood to a muscle of the heart gets clogged. And blood supply to that part of the heart is stopped, and that the heart muscle eventually gets deprived of oxygen, of food, of nutrition, and then eventually dies if nothing's done. And same thing in the brain. The brain has blood supply that's crucial and critical, and a stroke is basically when the blood supply is compromised. Now, there are two types of strokes. There is an ischemic stroke and a hemorrhagic stroke, or a stroke where a clot happens in a blood vessel. That's the ischemic stroke. A hemorrhagic stroke is when a blood vessel tears and there's a bleed into the area. The basic idea is blood flow to a particular area of the brain is compromised. The big difference between heart attacks and strokes, though, is that the heart muscle is actually very tolerant of ischemia. It's very tolerant of lack of oxygen. The brain, not so much. You have very little time once blood supply to the brain is compromised. You have very little time before it dies, and so you have to really act very quickly once you recognize a stroke. The other difference is when the heart muscle. Sorry. When the heart muscle is deprived of blood, there's pain. You feel chest pain. In a stroke, it's usually painless. There's no pain. And so you have to learn to recognize the symptoms of stroke. Okay. This is just a picture kind of showing you the head and the arteries or the blood vessels that supply the brain. And this is a very common site in the neck for obstruction and a clot. The clot can either block the blood flow here or then send a number of clots to the brain and block different areas of the brain. So these are just a few facts about stroke. Stroke is a leading cause of death and disability in the U.S. Many people recognize a heart attack. Everybody knows what a heart attack is. Stroke is almost as common as a heart attack, although not many people really recognize stroke as that serious of a condition. So around 800,000 Americans suffer from stroke every year, and around 135,000 die every year from stroke. So roughly every 40 seconds in America, somebody suffers a stroke. The good news with stroke is that the death rate is actually falling because of the advanced care, improvements in care. The death rate from stroke is going down, but the disability rate is rising. So a lot more people are surviving strokes, but then being disabled. And we have a lot more stroke survivors, so around 7 million stroke survivors. According to most experts, around 80% of strokes that occur are preventable, so if we take the right measures. So a bit about women and stroke. Even in the medical community, a lot of people, in general, women are safe sort of from cardiovascular diseases until they hit menopause. Women don't generally get heart attacks, don't generally get strokes, but strokes actually are much more common in. They kill more women than a very common condition, breast cancer. I'm sure many of you know people who have breast cancer or who had breast cancer. Stroke is more common than that in women. The differences in stroke in women versus men is that women are more likely to die from a stroke than men. So more men get stroke, but when women get stroke, it tends to be more deadly, and it also tends to leave women with more disability. The one anomaly which people are still looking into, we're not sure what exactly is causing it, is that in younger women, stroke incidence is rising. And when I say younger women, I mean in kind of the 40s, 50s, the stroke incidence is rising. One of there are different theories. Some of it is pertaining to lifestyle, smoking, things like that. So I have a little bit about Khojas and stroke. Now, there's no real studies on Khojas as a community, but the Southeast Asian community in general tends to have a lot of stroke risk factors. So this slide serves two purposes. It tells you the risk factors for stroke, and then it puts it into perspective as a Khoja community. So the risk factors for stroke are high blood pressure or hypertension, diabetes, obesity, smoking, a sedentary lifestyle, and high cholesterol. And it tends to be that the Southeast Asian communities in general tend to have all of these. So we have all the ingredients for having a stroke. And in my opinion, I'm not, I don't know if this is fact or not, or there's no research, but I've heard of a lot more, Khojas having stroke, both within the U.S. and in Africa, and I've heard of people who are getting strokes. Okay, so what are the symptoms of stroke? So one thing to realize in stroke, it's usually a sudden symptom. Anytime a blood vessel is blocked, the symptoms are often very sudden, and they're usually not subtle. So a sudden headache is one sign of a stroke. Usually it's the worst headache of your life. It's not just a regular headache you get after a long day of work, but it's a sudden severe headache. Sudden difficulty seeing, trouble seeing, usually on one side, not being able to see one side properly. Sudden dizziness or trouble walking, so problems with balance, falling to one side. Sudden confusion or trouble speaking. Now, trouble speaking comes in two different varieties. One is not being able to speak at all, not being able to get the word, and the other is actually garbled speech, where the person who is speaking thinks they are speaking all right, but other people around him realize that no, there's something wrong, the speech is garbled. And then finally, sudden numbness or weakness of one of the extremities, either a leg or an arm, and it's usually sudden, and it's either you can't feel the arm, can't feel the leg at all, can't feel half of the face, or you can't move it. Now, when a stroke happens on the right side of the brain, usually the person is not aware that he's having the symptoms. So other people, bystanders, observers, have to play a critical role in recognizing stroke symptoms. So what should we do when you recognize a stroke? So you've seen all the signs, sudden numbness, sudden weakness, sudden difficulty speaking, sudden loss of vision. So when you recognize this in somebody or in yourself, what should you do? So the American Stroke Association came up with a mnemonic, an easy way to remember. And the mnemonic is FAST, F-A-S-T. This is the month of fasting, so I guess it's another additional way to remember it. Excuse me. So F stands for face. You ask the person to smile. Now, in a person who has a stroke that's affecting a part of the brain where the face is affected, you'll see that the smile will be not symmetric. It will be asymmetric. Basically, instead of smiling like this, you might see a droop where they only smile with one side. Or if you ask them to close their eyes, they may not be able to close one side of the eye. So F for face, ask them to smile. A for arm, ask the person to raise both arms. So ask them to raise both arms like this. Usually they won't be able to keep one arm up, or either they won't be able to raise it at all or won't be able to keep it up. Then S for speech, ask them to speak a simple sentence, today is a good day. And if they have trouble saying that sentence, then you know that they may be suffering from speech. So F-A-S, and then T finally, time to call 911. Now, I'd said earlier, in a stroke, the brain is very sensitive to lack of oxygen. And the medicines we have for stroke, which I'll talk about very briefly, you have a very short window in which they're effective. There's a medicine that can only work within around 3 to 4 hours. If you reach the hospital within 3 to 4 hours of your symptoms, then you can get that medicine, a clot buster, But if you reach later than that, that medicine is not an option. So it's very crucial to, as soon as you recognize the symptoms of stroke, you call 911, because every minute matters. Time is brain. They say time is money, but time is actually brain. Okay. So what can we do to prevent stroke? So basically reduce our risk factors for stroke. We talked about the risk factors. Know your blood pressure and make sure it's under control. So those of you who don't know your blood pressure, make sure you make ways to find out what your blood pressure is, and then make sure it's under control. Find out if you have a condition called atrial fibrillation. It's a condition of the heart where basically you have an abnormal rhythm of the heart which predisposes you to form clots in the heart, and then these clots go to the brain. So find out if you have that. If you have that, there are medicines to control it and to basically prevent clots. If you smoke, and in parentheses, because hopefully nobody drinks, but if you smoke or drink, alcohol is one of the things that actually in stroke, it's a known risk factor for stroke as well. Many times you'll hear red wine is helpful or whatever, but not in stroke. And alcohol is definitely increases the risk of stroke. So if you smoke, and smoking is a huge risk factor for stroke. So if you smoke, try to make efforts to cut down and eventually quit. Ramadan, I think, is a good time. You don't smoke during the day, so maybe you can use that as a launching pad not to try to cut down on smoking. And by the way, I tell this to myself first, and then I tell that to you all, because lifestyle, and that we have to also do the same. So know your cholesterol. If it's high, treat it. So make sure you know your cholesterol numbers. If you don't know it, ask your doctor, or they're actually, there are places where you can get cholesterol checked for free. There are fairs or stuff like that. Learn what your cholesterol is, and then make sure it's controlled. If you're a diabetic, first find out if you have diabetes, and then make sure it's controlled. Exercise, and again, I tell myself first, before telling all of you, we need to be more active. As a community in general, we are very sedentary. We tend not to exercise. We see our neighbors, younger people, older people, running, jogging, bicycles, so we need to try to be more active, exercise. And then finally, enjoy a healthy, balanced diet. And by healthy, balanced diet, basically it means first is moderation. We shouldn't overeat. And then the second is having all the food groups in there. So fruits, vegetables, proteins like meats and eggs, and a little bit of carbohydrates. And you'll hear a lot about low carb diet, low fat diet, all these different kinds of diets. The bottom line is, have a balanced diet and be it in moderation. As a Southeast Asian community, as a Khoja community, we tend to not be fruit eaters and vegetable eaters, and also we tend to cook a lot of stuff in a lot of oil, and we should try to reduce that. And you can try to use as much olive oil as possible as a substitute instead of regular oil. So this is just a brief slide showing why people don't recognize the symptoms of stroke, and why people eventually then don't get the treatment. Most, even in America, most people reach the hospital too late after having a stroke. And why is this? Some people don't recognize the symptoms, and some people it's denial. You get the symptoms and you feel like, no, it can't be happening to me. It's nothing. It'll go away. Thinking, oh, it's a stroke. I can't do anything about it. Now, 10 years ago, this was true. And even in the medical community, a lot of people still believe you can't do much for stroke, but you can. And there's a lot more now that can be done. People worry about the cost of care, and then a lot of people fear or don't trust hospitals. So very briefly on what are the treatments for stroke. So we've talked about stroke. What happens if you do get a stroke? So in the ischemic kind of stroke, the variety that a blood clot blocks the area of the brain, there is clot busting medication called TPA. You might have heard of clot buster in some of these movies or something like that. Basically, it's a medicine that they give you by IV, and it's supposed to burst the clot and make the way for the blood to pass again. And then, but it only works around, maximum 3 to 4 hours. If you reach the hospital later than that, you can't get this medication. And then there are clot removal devices. So if somebody comes in and it's a certain type of clot in a certain vessel, it's very small section of strokes then qualify for this, where you can go in with a device and actually try to extract the clot. And it's much more dangerous. The mortality is higher, but it's an option. For hemorrhagic strokes, basically where you bleed, there's other options where you try to clip the area which had the bleed or coil it. And that basically concludes the presentation. Now, I do apologize. I was actually invited somewhere else for Sahri, so I'll have to leave. But I'll take a few questions, and actually, maybe I'll invite all the other physicians to come up. I'll take a few questions, and then I'll have to leave.
It talks a lot about taking aspirin now, 81 milligrams.
Yes.
Is that useful?
Yeah, a daily baby aspirin daily has been shown to be preventive in stroke as well as heart attacks and stuff like that. But you, go ahead.
What about taking, if you're traveling, to take some larger doses of aspirin? Somebody told me 325 milligrams 2 days before you go to travel.
I haven't heard of anything like that. I'm not sure. Maybe the other doctors can comment. Of course, I would talk with your primary care doctor about it. A daily baby aspirin in general in people above a certain age is recommended. Of course, there are certain people it's contraindicated. People who have trouble with bleeding, it might not be the right medicine for them. But in general, baby aspirin is recommended. And people who take the higher dose, things like that. But I'll let maybe probably the primary care physicians comment.
What was the question again?
The second question was, I've been told that if you're traveling, especially long journeys, it's a good idea to take some larger doses of 81 milligrams to thin down your blood so that you're sitting in a flight for a very long period of time, at least
That's a
thins
different
your
thing.
blood a little bit so you don't have clots developing in your legs.
Well, the question is, when you're traveling, for example, flight for 8, 10, 12 hours, where there is risk of getting blood clots in the legs, is it advisable to take aspirin or any other blood thinners? Medically, it's not recommended. What is recommended when you are in a flight for so long is to keep on exercising, keep on moving your legs, your muscles, get up and walk around a little bit. That is all to help the blood flow. Aspirin, yes, a lot of people take it. There was a recent study which showed people who are taking aspirin and they don't have any history of heart disease or strokes, the aspirin is not beneficial at all. The aspirin is only recommended for people who have had heart disease or stroke for the prevention.
And the 81 milligrams is very useless for people who have not had stroke.
It's not recommended, it's not beneficial. Now, for people who have heart disease and stroke, they recommend the lowest dose, which is 81 milligrams.
Any blood thinners like commodine or whatnot, does those help in case of stroke or whatever at that time?
Sure. So basically, Coumadin or other blood thinners, and now there are a lot more. Coumadin, you have to get a lot of blood tests, and currently there are more oral anticoagulants that you don't need to get blood tests for. There's dabigatran, Xarelto, but they're recommended only for stroke which is caused by atrial fibrillation. So once you have a stroke, when you come into the hospital, they monitor your heart, and they'll put you on telemetry, and probably 24 hours or more, your heart will be monitored. If you have this abnormal rhythm called atrial fibrillation, then they will recommend a blood thinner, but not for regular stroke. If a stroke is caused by a clot because your arteries are narrow, because you have high cholesterol, and you don't have atrial fibrillation, then Coumadin is not recommended, or anticoagulants are not recommended.
You mentioned on one of your slides about headaches, right? One of the symptoms. Let's say I have a headache and it's really sharp. Is the headache, two questions, is the headache can be anywhere? And will those other symptoms also show? Because if you have a migraine, you have a headache right behind one side of the eye. So I don't want to be confused that if it's a migraine or a stroke or God forbid. So will all those symptoms occur at that same time?
So it's actually a very good question. So the headache, usually, people who have migraines usually have classic headaches. They know their headaches. They know exactly what the headaches feel like. Often they start gradually, and sometimes they even come with a premonition. So some people get, some stars or nausea or something before their headache, and they know it. So people with migraines know their headache, and usually the headache is the same. It's called stereotyped headache, same headache. In stroke, it's not the case. It's a different kind of headache. So if you have a history of headaches and you're now getting a very different kind of headache, then you should be worried. Also, it's usually a sudden headache. You'll be fine and you suddenly get a very bad headache. You get probably neck stiffness. And headache as a sign of stroke is the hemorrhagic stroke. It's the stroke which there's a bleed, and that causes a sudden headache. Usually that's all over, but it's not necessary. If you are bleeding in a very small area, you may not get the headache everywhere. But the key thing is that it's a sudden headache. It's not your typical headache. It's not stereotyped, and it's usually the worst headache of your life. It's very bad. So those are the key things to remember. Of course, if you're concerned, you need to seek care regardless of your head, whichever kind of headache you have.
Any question from the ladies?
Well, once again, like I said, the study showed that there is no benefit. A lot of people do take, because either their cholesterol is high or they have family history of heart attacks, strokes, and everybody says, oh, as a precaution, why don't you take aspirin? A lot of people do that. There is very little harm in doing it. Just like you mentioned, if you have history of hemorrhage or ulcers or something, then of course it's not advisable. So it's not going to hurt, but they showed that there is no benefit. Does that answer the question?
She doesn't feel good when she takes it. She doesn't feel well.
Well,
She's been prescribed by the doctor.
and did he say why he was giving it?
The EKG was not normal.
Because if somebody has, for example, a cardiac evaluation where they did a stress EKG and they found that there is some ischemia, that by definition is a heart disease. So if you have any blockage, even if it's not severe enough to do anything at this time, but there is blockages, then that would be an indication for taking aspirin. Now, once you have heart disease, if the stress test is positive, then aspirin is one of the treatments, besides other medicines.
Thank you, Doctor. Dr. Nadia.
Aspirin, without having any heart attack, prior heart attack or stroke, just as a blood thinner, does that in the long run have an effect on any organ of the body, like kidney or liver?
There are some side effects of taking aspirin. One of them is hemorrhage, because it thins your blood. So one of the problems especially we see in older people, is falls, when they fall down. And if your blood is thin, it's easier for you to hemorrhage, especially head injuries, even fractures and other things. So that is one of the side effects. People who have ulcers in the stomach, they can bleed from aspirin, and that could end up, they could end up in the hospital. So those are the serious side effects. Now, when you look at what are the benefits, the study showed that there's no benefit. And also, to answer your other question, no, it doesn't affect the liver or anything. Hemorrhage is the only problem. Now, if you're allergic to aspirin, then of course that's a different thing. But it doesn't affect your organs.
The second question that I wish to ask is with regard to family history of stroke. For instance, father, mother died of stroke. You see, you don't know previous to it, of course. Is it genetic? Will the son or the daughter be at a higher risk of getting stroke because his father and mother died of stroke?
So a lot of conditions, including stroke, are what we call multifactorial, meaning there are some genetic conditions that can predispose you to stroke, but then there are also a lot of environmental factors. And a lot of, we know fairly a lot about stroke, but we don't know everything. So there are many cases of stroke which are called cryptogenic stroke. We don't know what caused them. People, have no family history, but they get a stroke. So the best way to understand it, it's multiple factors that act together. If you do have a family history of stroke, if you have a grandfather, father, mother, grandmother who passed away from stroke, your risk of having a stroke is higher, but it's not a definite that you're going to get a stroke. So if you have a family history of stroke, that means you need to take even more care to basically the risk factors we talked about, high blood pressure, obesity, diabetes, to make sure that all those are controlled. In Southeast Asian communities, there tends to be higher cholesterol, and some of it may be familial. Even without the diet being bad, they have high cholesterol. So it's very important to know your cholesterol and make sure that's controlled as well. So does that answer your question? So I think I'll take your leave, but I want to thank all of you. It was definitely an honor and pleasure to be here, and inshallah, keep me in your prayers, please.
Do you have a moment? I have a question. You listed all the risk factors for stroke, and one of them, of course, was diabetes. I know that smoking, sedentary lifestyle, etc., etc. When you improve those conditions or rectify those conditions, then it reduces the risk of stroke. But do you know if there is definite evidence that controlling the diabetes reduces the incidence of stroke or not? And the reason I'm asking you that question is that we know with MIs, cardiac infarction, the diabetics have a very high risk for coronary artery disease. However, when you reduce the blood sugars, reduce the A1C, the risk does not go down significantly as far as MI is concerned. Does it go down in stroke or not?
So I think a lot of times in medicine, you have studies initially showing one thing and then showing another thing. Just like we mentioned with aspirin, I guess there's a recent study that shows it's not been that beneficial. Recently there were some studies questioning, is controlling of diabetes, is it that beneficial? So there is a benefit that has been shown, but whether that benefit is clinically significant is not yet known. Although in acute stroke, so when we're talking about prevention of stroke or chronic stroke, somebody who's had a stroke, it's very different from in an acute stroke. In an acute stroke, if you come into the emergency room with a stroke and your sugars are very high because of uncontrolled diabetes, there's definite risk of increased bleeding. That you'll tend to bleed, and even if your sugar is over a certain level, the medicine TPA is contraindicated. You can't get it because it's so high, and your risk of bleeding is very high. But in overall, whether chronically, whether really tightly controlling the blood sugar, whether it gives that much benefit is debated. Having said that, diabetes does more than just increase your risk for stroke. If you have very bad diabetes with uncontrolled sugars, you tend to get more neuropathy, problems with numbness in your legs, not able to feel your legs, and you get retinopathy, problems with the blood vessels in your eyes. So it's not that you shouldn't worry about diabetes at all. It's more, you should try to control it. Whether it prevents stroke as much as was thought before is debatable currently.
Thank you. Thank you, appreciate it.
Thank you, Dr. Kaku. We must thank him for having given us even that little time answering the questions. And Dr. Kaku, we really, once again, thank you very much for having us your time. And we look forward to welcome you anytime when you're free. And you're not far from here, and hopefully maybe you'll end up in Orlando.
Inshallah.
Thank you very much. Thank you very much. We will continue with this session for another about 15 to 20 minutes, inviting questions from the floor. And the two prominent doctors, I'm sure they'll be willing to answer your questions. So we still have some time for question and answers.
This is fine. We can use this.
Well, while you're still thinking about the questions, when I was asked for this session whether to present a topic, I'm an internist, so I don't just deal with one specialty. I deal with so many different diseases, and it's not fair to just give a lecture on one topic. That's why I suggested that we have a question-answer session, because it's a fact that people who have certain diseases, they are more interested in that. They're not interested too much in the other things. Now, in medicine, of course, there are so many diseases, but we commonly want to deal with common diseases. And common diseases such as heart disease, strokes, diabetes, high blood pressure, cholesterol, overweight, smoking issues. And then there is two other classes of diseases that we see commonly: infections. A lot of people have infections and issues about immunizations for the older people and what should be done. And then the third group is the cancer, which is, so if you have to cover everything, of course, it would take a long time. But with question and answer, we thought, few topics will come up that we can discuss. To emphasize on medicine, there are basically, one, the disease. Number two is the treatment. But most important are the two other things: screening and prevention. And hopefully some of the questions will come, like he already discussed some of the, well, he didn't discuss about screening. Stroke, he said there are two kinds, one with hemorrhage and one without. That's why when you have a stroke, and hopefully you go to the hospital where they can do a CT scan or MRI scan right away, because you want to know whether there is hemorrhage or not before you give that clot buster. If you give the clot buster and somebody is having hemorrhage, you'll just basically kill him, because he'll hemorrhage more. So that would be something. When we talk about family history of heart disease, stroke, there are screening tests that can be done. A lot of times you can do the ultrasound of the carotid arteries, and if you see blockages, that would suggest heart disease. They do it all the time, stress test and all that. So if you have a family history and you're getting to the age where the risk is getting higher, you start looking into, the doctor will look into screening tests. Same thing with cholesterol, diabetes, high blood pressure. All those screening tests help to identify the disease earlier rather than find it first time when you end up in the hospital with a stroke. Prevention, again, a lot of diseases can be prevented. And of course, I don't want to go into all the details, but most commonly you have heard smoking causes a lot of problems: cancer, strokes, heart attacks. So quitting smoking, again, will prevent. Diabetes, high blood pressure are quite common when you are overweight. So controlling weight, exercise, and so on. The list goes on and on. There are so many things that one can take care of your own body so that it would last for a long time. Just like you take care of your car, if you do good servicing and you take care of everything before it really breaks down, it will last a long time. Our body is the same. We need to take care of it. What we eat, how much exercise, our weight, medications, stresses, all those different things. So we try to minimize and try to avoid some of those things. Now, after saying that, now I'll wait for the questions.
Maternal side, you have no symptoms, but you have a strong family history of cancer.
Now, cancer is a big category. There are so many different kinds of cancers. Some cancers may have some family history. Common in women is the breast cancer. If you have a family history of breast cancer, the Medical Association recommends that you start early screening with mammograms. Normally, all women have to have a mammogram before the age of 35, just as a baseline, and then after the age of 40, you do it every year. Now, if you have a family history of breast cancer, then it's better to do it earlier, maybe even in your 20s. So that is for breast cancer. Some cancers, there may be some family history, but very difficult to screen for, like pancreas. There is some family history that contributes, but cancer of the pancreas is very difficult to screen unless you do CT scans every year. So that's not very. But diseases, or before I go to diseases, some other cancers, lung cancer, there are some families where there are multiple cancers. Now, those people need to be screened. And when you go for a physical, now my patients, when they come for their annual physical, we do a complete screening. For women, the mammograms, pap smears, ultrasound of the pelvis for ovarian cancer. We recommend doing a colonoscopy for colon cancer. We do the blood test to make sure that there is no leukemia or anything. And then there are some other blood markers for ovarian cancer, for liver cancer, that we order if there is high risk. So there are some screening, but not too many. The best one which has been very successful is the mammograms in women, because mammograms don't prevent cancer, but if you can detect cancer early, you definitely have a very good chance of cure. And we are seeing a lot of cures.
How you screen adenocarcinoma? It's like most of the family members have that stomach cancer.
Okay, adenocarcinoma is a glandular cancer of either the stomach or the colon. And again, like I said, if it is a colon cancer or GI, gastrointestinal, colonoscopy, if there is, stomach cancer is not as common as it used to be, but we still see it. But they can do an upper endoscopy and look in the stomach on a regular basis to see. We also do the annual stool screening for blood. So if you see blood in the stools, then we look into the intestinal system, colonoscopy, upper GI endoscopy. When you talk about adenocarcinoma, that is a general word, because it could be adenocarcinoma of the lung, of the GI system, of different glands. one of the problems with cancer, whatever we can screen, we will screen for. And then there are some of the symptoms that one has to be aware of. You know, unexpected fevers, unexpected weight loss, any bleeding anywhere, and then the annual blood work and everything if you suddenly become anemic. I mean, something will help us to determine where to look, or if it's an abnormal liver test, so that would help to look more into that particular area. So for those who have insurances, make the best use of it. Do all these physicals, the blood tests, the screening tests. I'm talking about over 50 or over 40, 45. So take advantage, and it will help.
Any other question? Please. Brother Kareem. Please.
Can you do walk every hour or extra exercises in the evenings?
When we talk about sedentary life, it doesn't really apply to like sitting job for 6, 7, 8 hours. We are talking about on a daily basis. If you sit 8 hours in the office and then the rest of the 8 hours in the evening you're sitting on the couch watching TV and then you go to sleep, and you do that every day, that is pretty sedentary life. Now people, you know, at work, of course, it's different, but every day when you go home, you can start or get into some exercise program. And that is what helps with all the systems, you know, circulation, breathing. Sitting 8 hours, it's hard. But what is recommended is that you stand up and stretch yourself, maybe even walk to the bathroom or just walk around the room, maybe, you know, every couple of hours or so. It's good. It kind of freshens you up, and especially if you're working on the computer, it also is nice to get your eyes away from the screen. It does help. It helps your neck muscles and other things. So people who have problem like, especially on the computer, who keep on getting these neck pains and the arm pains, we recommend to them that they take a break every couple of hours, even for 5 minutes, just to get up, stretch, and walk around, and that's good. But at your free time, that is where you can do the exercise.
Just to expound on that in a little bit, you'd also asked about exercise. So the current recommendation, the exercise recommendation used to be 30 minutes a day, 3 to 4 times a week. And the current recommendation is a little bit strange. It is 150 minutes a week, and it does not specify whether you need to split it or not. But personally, I would recommend to split it into 4 days at least, and there is a reason for it. Every time that you exercise, your metabolism goes up for a period of about 48 to 72 hours. And that was the rationale behind exercise 3 to 4 times a week. As far as the kind of exercise is concerned, most of the data is with walking, and the general feeling is that as far as your cardiac health is concerned, diabetes is concerned, walking is just as good as jogging. There is no data with any of the other exercises that we traditionally do. You know, either you use an elliptical or you use a bike, there is no data with that. So the data is predominantly with walking and jogging.
I think we'll take one more question from either side. The floor is still open. Yes, yes, Dr. Dutt.
Symptom, or do you have multiple systems? And if it's multiple, is there any combination of symptoms that you should look for?
For what? For stroke? Okay, as far as strokes, I mean, I have seen enough, I can explain. There are some that are very obvious. Somebody just says, I can't move my side. You know, there's no doubt about that. So if a side is paralyzed or he can't move his arm or leg, you think about stroke. The other obvious one is the speech. If somebody is talking, if I'm talking clearly right now and suddenly I start mumbling and jumbling, you know, you better call 911 because that could be a stroke. So those are obvious. Now there are some that are asymptomatic. There's no symptoms. You know, you sometimes go to the doctor or you go to the emergency room and for something else, they do an MRI and they say, oh, you had a stroke before. And you say, no, I don't know about it. Well, your scan shows that you have one stroke. You didn't even know. So that was completely asymptomatic. Some people have what we call mini strokes. Those are completely asymptomatic. So those two categories, you know, one is obvious, one is asymptomatic. You can't do anything about it. But there are some in between, and there are other symptoms too. So somebody, now, headache is only caused by hemorrhage. A hemorrhagic stroke will cause headache. So if somebody has got severe headache and is showing signs of getting a little bit unresponsive or not responding normal, you get concerned. There are also some strokes that are only transient. Your speech is gone, but then 5-10 minutes later it's cleared. So that was a transient. Anything that lasts less than 24 hours, we call it a TIA, transient stroke. It may be even a paralysis. But if it clears up, it doesn't mean that now you are clear. You still need to be evaluated because that could just be a warning sign. You know, so you get a transient stroke and then you get evaluation and you find what's going on. Other symptoms could be visual symptoms. If you suddenly lose one side of your vision or one eye goes blind, that shouldn't happen. I mean, you worry about a stroke. Sometimes you may just feel numbness. Your face is completely numb. Now, it may not be a stroke, but it is suggestive, especially if it's on one side. Remember, strokes only happen on one side. Your brain, right side of the brain controls your left side of the body, and vice versa. So, if you get a stroke, a clot in one part of the brain, it's going to affect only one side. So if both legs are paralyzed, that is probably not a stroke. That is something else. So any numbness or weakness or paralysis. The other thing is your gait. Sometimes when you're walking, you find that you can't walk straight or you're moving on one side. You know, I mean, you may be feeling fine, but it could be just subtle that you're a little off balance or you can't walk a straight line. You're moving on one side. That would be suggestive that something is going on. So those are the common symptoms. And then there are some vague symptoms which don't really tell us very much. You know, you come and say, oh, I'm dizzy, or I passed out, or, you know, I just feel weak all over, you know. Those are vague symptoms.
Numbness sometimes does indicate that there has been a stroke. Now, many times when we get up in the morning, if we have not slept or we have overslept on one side, you get with your hand gone completely numb. But then after a few minutes, it recovers. You see, you are normal. Or one foot goes numb. You see, but then after a few minutes, it recovers. You are normal. Does that have any relation with stroke? Thank you.
Numbness that affects one side of the body, more suggestive of stroke. The numbness affects the whole area. Now, what you're talking about, I mean, there are all kinds of numbnesses. You can get numbness because you sat cross-legged or like you said, you sleep on one side and you wake up, your arm is gone to sleep. That is not a stroke because it should recover within a few minutes as soon as you relieve the pressure. Some people have numbness from diabetes. People who have diabetes, they say, oh, I can't feel anything in my... That's a neuropathy or nerve damage. So that kind of numbness is not really a stroke.
I think at this stage, we'll call the end of this session. And before I do that, I'd like to thank you all for having participated in your precious time. And I'm sure this has been a very valuable and useful discussion. For those who have not received any email, please give your email among the gents. You can even email the HIC or Brother Mustafa Pir Mamad in the gents side and Sister Shakira in the ladies side, so that all those seniors 55 and over are registered. This way, you have constant communication. But in addition, I'd like to thank two doctors here who have been very, very helpful in answering the question, and I'm sure we found it very, very useful. Once again, I would like to thank you all for having participated. And finally, we have two people. First, the management, in particular the president, who is just in front of me. He has been very, very helpful in accommodating us. And secondly, you have somebody there who is very shy, low profile, none other than Muki Yusuf Ali. Without him, this thing would not have been here. And you can see, even after this time, we'll be going to have the Sahri. Without him, believe me, you will miss it. So with that, I say thank you, and I will request Ma'alim for a short dua to bring this session to an end. Ahsant.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم صل على محمد وآل محمد اللهم ارزقنا صحة كاملة وارزقنا خير الدنيا والآخرة واجعل محياي محيا محمد وآل محمد ومماتنا ممات محمد وآل محمد واحشرنا من زمرتهم برحمتك يا أرحم الراحمين وصلى الله على محمد وآله الطاهرين صلوا على النبي.
Sahri is ready. Please do not leave without having Sahri. Thanks. Ladies on the right side of, and gents on the left from me.